Hi everyone, my name is Dr. Pamela Muga, an obstetrician gynecologist working in partnership with Ponea Health, and we're going to be discussing some of the do's and don'ts in pregnancy. So pregnancy is a normal part of your life, and some people wonder, should I do exercise when I'm pregnant? Yes, by all means you should, as much as you can. So if you had already started doing exercise before, you can continue. What changes with pregnancy is likely the intensity and then the type of exercise. So as your pregnancy progresses, and depending on your state during the pregnancy, which will evaluate in your antenatal care, then you might need to change the type of exercise that you do. Weight-bearing exercises tend to be a little bit more tricky in pregnancy because there are certain changes that occur in your posture, and also we don't want you to put a lot of pressure on your abdominal muscles. So those are some of the things that you would have to change. For exercises like walking or swimming, then those are actually recommended. In terms of running and jogging, it depends on your physical state before the pregnancy. So if you had been doing that actively before, then it may not actually interfere with your running schedule until much later in the pregnancy. So exercise is important. It has been shown to improve pregnancy, improve the process of labor, and slightly make it a little bit shorter. So it's always good to exercise during labor. In terms of eating, a lot of people are told to eat for two, but you only need to increase your calorie intake by about 400 kilocalories. So don't eat too much for two. 400 kilocalories is like an extra snack. Yeah? So just increase your intake by an extra snack. Ordinarily, it should be a healthy snack. So as much as you're able to do that, then that would be quite good. In terms of what not to take, then we don't recommend that you take any alcohol during pregnancy because the baby cells are forming, and the effect of alcohol, even those small amounts, is unknown. So it's always important not to take any alcohol. Smoking releases quite a number of toxins into your bloodstream, so that's also not recommended. Also, we don't encourage you to do any drugs in terms of drugs of abuse or even over-the-counter medications. It's always good to seek medical advice before you start taking any medications. In terms of tea or coffee, then one of the issues that we have is caffeine. So it depends on the amount of coffee or the amount of tea that you're taking. 1 cup of any of those is not too bad, but anything that you start to take too frequently then becomes a problem. So it's always to control your intake of those. 1 cup, maybe 2 cups is not too bad, but more than that, then we start to worry about the amount of caffeine in your system because that can actually interfere. Thank you for engaging with me in this episode. You can book our services at ponea.com. We look forward to meeting you in the next episode.